You're on your way to a patient with traumatic injuries. Now the job's in the middle of nowhere, so it takes a little while to get to. But when you do get there, the fire service is already on scene. As you're getting out of your motor, fire come over and say there's a patient in the back of a lorry and a large load has fallen on top of them. They reckon the weight is up to 2 tons, but they say he is awake and talking. So you get your kit and head over to the back of the lorry where a forklift has jacked up this weight and fire have put shoring in place and said it's safe to go inside. So firstly, would you be happy going into this environment? So you and your crewmate do decide to go in. Now it's a cramped space both width and height. The fire service have put the patient on oxygen. He is awake and attempting to talk, but he can't make out what he's saying, and he's positioned on his knees almost like he's in a fetal position. You start your assessment while your crewmate is cutting off his clothes. You can't see any cat hem and he is talking, so you deem his airway patent. So you feel his back for rise and fall and it feels equal, but you can see a small section of his ribs has paradoxical movement. There's a large amount of bruising and abrasion mainly on the right hand side, and when you listen to his lungs you can hear crackles all over the right hand side as well, but his SpO2 is fine with high flow O2. As you've been doing this, your crewmate has hooked him up to the monitor and his heart rate is all over the place. 1 minute he's bradycardic and the next he's tachycardic, but his blood pressure isn't too bad. You can't assess anything else properly because of his position, but his temp and BM is normal. He's answering questions yes and no, but grunting as if he's in pain, and hems are on the way. Now how would you manage this patient? What treatment would you give this patient, and what do you think is going on? Let me know in the comments.